Hello, 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 and hope you're having an awesome Sunday. I've had a really good one. Annalie and I are just from church, and we've had an amazing time in the presence of God, and I believe that you have had one too if you go to church. My name is Pauline Lehman. For those of you who are meeting me or joining us for the very first time on Star Richards Community Initiative. I'm the founder of Star Richards Community Initiative, and our mission is to empower parents to raise high achieving children and break the cycle of pupil underachievement in education. We also aim to raise aspirations of children and young people within our communities, as well as promote the well-being of children and families within our communities. And today I have with me Anulika. Anuli, we'll call her for short Ifezwe. She's one of our practitioners within Star Richards Community Initiative. We have a team of highly experienced and highly qualified practitioners in different areas. So I'll just quickly talk about her experience, her expertise, and then we're going to go straight into our discussion. So she's a health visitor with tremendous experience. She's a health visiting practice teacher. She's also a perinatal and infant mental health lead in Central Manchester Foundation Trust. She works with families to improve outcomes through preventive work and targeted therapeutic work for families with additional needs. And the issue we're going to be discussing today, which is mental health issues in children and teenagers. It's not just across Black communities, across all communities. In the past few weeks, it's been on the news, on the media about the rise in mental health issues within children and young people. And one of our goals really is to be able to help promote, the well-being of children and families, because we believe that if children are not well psychologically, emotionally, they won't achieve their potential. And that is why we believe that parents need to understand the issues that surround children's well-being so that we can better support them to maximize their potential. Thank you for those who've joined us. We hope it's going to be a very, very fruitful discussion. And if you have questions, if you have contributions, you want to share your experience, please, as we go along, do not hesitate to just type it in. Hello, Zanga. Thank you for joining us from Cameroon. That's really good to have a guest from Cameroon joining us today. So, mental health issues. For me, mental health issues is something that I've always wanted to know more about, because from where we come, from Africa, where we originate, when they talk about mental health problems, what comes to mind, if for those of us from Africa, is somebody, what we call a mad person, walking on the streets without clothes, with unkempt hair, and that kind of thing. But in this part of the world, they're talking about mental health issues on the increase across the population, but then we don't see people going out naked with unkempt clothes and unkempt hair. And so I thought I need to understand, I need to understand more, and the parents out there need to understand more, especially because there is an increase amongst our children. And, Anulika here is an expert for mental health issues in infants. Now you wonder, how do infants suffer mental health problems? For me, it's something that beats my mind, and that is why we've got the expert today to help us with that. So, Anuli, please tell us, mental health issues. It's a new thing to me. Please just tell us what mental health issues are all about, just so that, we can dispel the myth around it and all the wrong ideas that we have about it. So please tell us more about it.
Well, I would say, thank you very much, Pauline, for inviting me. I would say mental health problem is just a health challenge. In the same way somebody could have a physical health problem, people can have mental health problem that has to do with the mind, the way the mind functions, the way the mind operates, and the way the mind processes information. It ranges from infancy all the way, even from pre-birth, because it is believed that some of the experiences children are exposed in the womb can affect the functioning of their mind.
Wow.
And in effect, what we're looking at especially is around the brain development of the infant. We know that when the baby is still in the womb, there's quite a lot of neurons that is there, but these neurons are not connected. Okay, so you have a baby that is born, quite a lot of the neurons there, but the connections will come with the environment and the interactions and what this child is exposed to. So in effect, the first few months of life, there's a lot of wiring. If you look at the brain of a baby that is newly born and look at a baby that is maybe 6 months old and a child that is 6 years old, the way the brain is less. In effect, the way it's described is that human, you give birth to this baby, because you don't want the whole neuron connection to be there, because the head will be too big for you to push the baby out. So you deliver this baby, and then within the first few months of life, the first 3 years of life being so critical in wiring the emotional well-being, a baby is born ready to interact. So is born already knowing the voice of the parents, already ready to interact, ready to follow, ready to fix around things. But then the interaction comes with environment. The issue around the gene being the basis for how people function is now actually out of the way. It's not about gene now. It's about the gene with interaction with environment. Sometimes people are actually born with the genetic code that is meant to function well, but with the environment, there are things called the epigenetics, which could code the function of the expression of the gene. So the gene, take for example, a child is born with the genetic coding that says you're going to be intelligent, you're going to be, but then with environment that is traumatic, that particular gene could be covered up, and that particular gene will not be able to express itself. So the wiring of the brain is so key to the mental health of babies. And as they get older, you see, babies that are struggling to settle, babies that are highly irritable, babies that are...
We're getting to that, yes. So it's quite interesting that you spoke about... hello, Falsa, thank you for joining us today. Good to have you. Hope you're having a wonderful Sunday. So, Annalie, you spoke about during pregnancy that, the mental health, the wiring of the brain and things like that can be affected. So what are the sort of external things that the parents could do that would affect a child's wiring, brain wiring?
Okay. So a lot has to do with the well-being of the mom.
Right.
So when you're thinking about the mental health of a baby, and you're looking at the mental and an emotional well-being of the mom, and also of the dad. Okay, take for example, if a child is in the womb and this mother is constantly exposed to stress, there is what we call the release of the cortisol. Cortisol is known as the stress hormone. When the mom's cortisol level is high, the baby's cortisol level is also high, and cortisol is toxic to the brain formation. Yeah, a mom that is exposed to a lot of stress, domestic violence, and stress, even war, stress in the environment. If you look at the baby when the baby is born, the effect of that mom's traumatic experiences has a traumatic effect on the child. So the question I will ask people is, when people are pregnant, what are the things you sift out of your life? What are the things that doesn't really matter, that needs to be out of the way? Because as a lot of people will go a long way to nurture their physical well-being. They'll make sure they eat food that gives them high iron, and they make sure they have all the vitamins, and it's very good because these vitamins also is necessary for the well-being of your child. But the other thing that is so key is, what stress level are you exposed to? Okay. If it's not going to help you, then it is very important that you just get rid of it and try and work within, the life of being, being chilled, if I'll use the word being chilled. If there are things that you're struggling with, seek help early. So at least you can get the help you need early enough. Not just for your own well-being, even for the well-being of your baby.
Absolutely. I'm talking about pregnancy again. Hello, Veljivet, how are you? Thanks for joining us today. I hope you're having a wonderful Sunday. You spoke about the things that might stress out a woman during pregnancy. And what comes to mind also is the relationship with the partner, because if the relationship is not going on well, that tends to also bring about a kind of traumatic atmosphere around the mother, and that might affect the baby as well. So thank you so much for sharing that with us. Life is a learning process. We're learning every day so that we can become better. The next thing I want us to talk about, different types of mental health problems. So what are the types of mental health problems? This will help us as parents watching today to be able to identify the symptoms or the signs in our children and in our teenagers.
Okay, so if you look at little children, you have something called attention deficit hyperactivity disorder, and then you have autism on the other side. You have different kind of learning disability, which is linked, some of them are linked to the wiring of the brain, and the way the cognitive functioning of the brain, the social functioning, the communication functioning of the brain is wired. And then as people get older, you have different kinds of mental health problem. It could be something like anxiety. If you think there is the social anxiety, and there is the anxiety that is related to going out. Then there is, they call one called agoraphobia, where people will not be able to stay in an environment where they think they will not be able to escape easily, like in a big crowded place or in an enclosure. And then different kind of anxiety disorder. Some people are just, social anxiety. And then you have
mean with children?
With children. And then you have the issue of depression, feeling low, feeling moody, not being happy. And it's very important that we begin early to think about how our children are feeling. Sometimes we feel the children just need food and they need their education, and and they just need to do the chores in the house. And this child could be going through traumatic experience, which is raising a lot of cortisol level in the system that is affecting the cognitive function, the communication, the social functioning. It could be a child that is exposed to bullying in school. It could be a child that is struggling to make friends. And within that, you might begin to see a child that is beginning to feel low. And so we have depression. There are different kinds of depression. And then there is different kind of personality disorder where, you have...
I just wanted to, before you go away from that one, I might forget what I wanted to say. Some of the signs you have described, are these not also normal responses to maybe like a child being angry? It's okay for a child to be angry. Humans get angry, as adults. Yeah. We get angry when we're not happy with things around us. So do we start to feel worried as parents once we see that a child is feeling low or angry?
What I would say to us is know your child. Try and get to know your child. What is the personality of your child? There are children that are naturally quiet, but within that, your child should be able to function socially. Your child should be able to communicate their feelings. Your child should be able to face challenges in life and not be thrown to pieces. Okay, there are normal, a child can be a bit low and unhappy because something happened. Yeah, we can get unhappy. But look at the level your child is going. When your child is now getting to the point of, just getting more withdrawn, and is not coming out of the room. And it's sometimes when they get to teenage age, we need to understand the difference between the normal teenage functioning. A lot of teenagers, when they get to that stage, because the brain rewires again in the teenage age. So like I say to people, if you feel you didn't get things right in the first few years of your child's life, that first 3 years of life, just know that you have a second chance when your child becomes a teenager. You cannot overlove your child. Try and get your child to know that you are there. In the midst of setting boundaries for your child, it's important to set boundaries, to set routines. It's important to make sure that your child is not pushing the wall, the barrier, the boundaries too much. So, but then do make sure that you give your child a listening ear. When they become teenagers, you have a lot of hormones, a lot of emotional outbursts. It's not the best to go when they're in that intense emotional outburst. Wait, when they've calmed down, go back. And then you get to the point where it might be just one word. If that word is going through for your child and all of a sudden it's not going through anymore and this child is getting more withdrawn, try and find out what's going on. Yes. There could be issues with relationship, friendship. Teenagers are known to value their peers so much. Teenagers are also known to take risk. They don't think about tomorrow. The pleasure they're looking for is a pleasure of now. Yeah. Okay? And so if you're thinking and you're saying to your child, oh, what happens when you become 25 years old? They don't get it. They're not thinking that way. So we get to where they are and we work with them.
Okay, so from what I gather, with our children, we need to kind of watch, just be more observant of the normal, how they are when they're normal, and then when things start to change, pay attention to that and pick on that and help them. And I think what our children really want is love. Love just covers everything. A child who is confident that whether I make mistakes or I don't get the grades I need to get, my parents still love me for who I am rather than for the results or for the things they do or for the fact that they are obedient. That love goes a long way to prevent, to curb these psychological traumas. So that's awesome. That's awesome. So what is happening? Why is there an increase of mental health issues amongst children and young people? What is different in today's age that wasn't there in the past?
I think one thing here now is that the society has changed so much. Children are exposed to so much. If you think about how many years back, 10, 20 years back, the technology is not the way it is. The family social structure is closer in many years back. Parents are working more. The peer pressure is becoming so intense. People are trying to catch up with what is happening and the speed with which things are going. People are not getting it. And when you see teenagers saying to you, you're not listening to me, you're not listening to me, you're not listening to me, what you say, because sometimes we just say, oh, what am I not listening? Actually, you're the one that is not listening, but truly, you're not listening. It's good for you to know, okay, what are you talking about? They might finish talking and it doesn't make sense to you as an adult. That's fair enough. At least you've listened. You just say to them, I have just listened to you. And then you take a step back and then think of how best to approach your teenager. Just know that is a phase. A lot of teenagers now are going through very, very, very severe mental health problem. The biggest is self-harming. The biggest is self-harming. There are a lot of people harming themselves secretly, and there's so many ways to harm themselves.
I think self-harm is a way of crying out for help, isn't it?
Yes.
And you said something really important, that children want us to listen. At times as parents, we want to keep giving advice. We want to keep telling them what we believe is best for them, but sometimes they just want to listen, us to listen to them. And and then as we get to know our children, then we can know when to chip in. And sometimes if they need help, they will just ask for it. But let's listen. And they value that undivided listening, not when we are on the phone or on our tablets or computers or watching TV and listening to them. They want us to tune things off. And parents, please let's learn to create these quality moments with our children, especially our teenagers, because just by listening to your child, you can pick up something. But if a child is talking to you while you're watching TV, you're not listening to half of the things they're saying. You won't pick up the moods. You won't pick up the message, not just in the words they say, but the internal struggles that they're going through you might actually miss them. So parents, please, let's make time for our children. Our children are with us just for 18 years of our lives and then they're gone. And let's ensure that we do what we have to do to curb this big problem. It is a big problem. I worked in school, and the rate of self-harm is something that is alarming. Okay, so let's carry on then.
The other thing is, sometimes they're doing it, you might not know. You might not know. When we talk about listening, you don't have to Some people say, oh, I don't have time, or maybe when we say creating time for your child, you say, oh, you don't have time. If you think about your 24 hours, you have time. When you're cooking in the kitchen, bring them in. Sometimes they might not want to be there. You know, some of the things I've learned to do is, okay, I'm going shopping. Do you want to come out with me? Let's go shop. And then in the car, the biggest thing you will say to your child, that one thing, is to get them off their technology. Yeah. They will come off the technology if they know you're going to talk sense. Yes. Yeah. If you're going to talk sense, if you're going to have a chat,
and you will not criticize or judge them.
And you will not be there judging and criticizing them. They will get off they will take the earphone off their ear, and they will take and they will start listening. And you can talk. You won't believe how much you can discuss and how much you can bring out. You know, but within that, okay, you get to the shop, you do the shopping on your way back, and then sometimes, okay, let's just go. You know, some children, so they go out with their friends to Costa Coffee, or they just go to have something, a bite, something to eat, and you just sit down. It might be a tiny thing, and then you start talking. In the kitchen is a very good place to talk, and you talk, and then your boys, sometimes it's good to just go and sit down on their bed. What you hear is, oh, mommy, what are you doing here? And then when you sit down on the bed, you're not sitting down, you know, rummaging through, because when you sit down and you're just, you know, pulling things around, and what is this here? Why is this? And that you're being critical and judgmental. Mommy, why are you here? You start smiling. I've just come here to have a chat. Is anything wrong with mommy coming to have a chat with this son? And then from there, and then you can just little by little, you continue to chip away with these things, and you get to where they are. The brain, the change in the brain formation of a teenager is so overwhelming. It's just massive. And as far as they are concerned, you're thinking about risk. They don't get it, you know, because they're thinking about the adrenaline surge that they would get there. Why is it that you have more teenagers that have accidents than adults? Or why is it that you have more teenagers taking this big risk and snowboarding and things like that, and skateboarding? It's because that's what they crave, that's what they like. So, but within that, we have to try and maintain safety. Yeah. You give them the opportunity, but look for a safe way for them to express that surge and feel happy. And it's also key to look at the friendship network of your teenager. Look at who they are relating with, because within that you might be able to be friends with your children's friends. That's something I would say to you. Absolutely. Within that, you'll be able to pick up things, and you'll be able to have a bit of laugh with them. The other thing that a lot of teenagers suffer with is, you know, something like, eating disorder. A lot of children are struggling. You might not know. You know, some are struggling with bulimia. They will just go eat, binge, and then vomit. People anorexia. Some are just eating what they call comfort eating. Yeah. They eat loads because they just, that's something that gives them joy. There's no joy anywhere else. What I would say to parents, please, in the midst of all the people that want to phone you, all your friends that want to speak to you, and your friends from work, your friends from church, your friends from home, you know, the aunties and uncles, and ask yourself, where are my children?
Absolutely.
Where are my children? You can't.
And interestingly, when if a parent looks at their day, you realize that you've probably spent more time connecting with people outside and very little time spent with the children. And it's so important as they grow up for us to really, you know, as you've described, pay attention to those little things, be there for them, try and understand them, try and pick up these signs and intervene at the right time before things get bad. So, in your experience then, Annalie, what do you think? How do you think these mental health issues eventually go on to affect a child's later outcomes in their holistic development? Yeah. And thanks to all those that I've not acknowledged yet for joining me, Shola and Elsie, and anyone else. I can't see the names. I'm not too sure. I'm not very used to Facebook Live. I'm getting used to it, so I can't see all those who are joining. But thank you so much for joining us, and I hope that this is really, really useful. And please, if you have any questions, just type them in so that we can answer your questions. If there anything that you've noticed with your child or your children, please just type them in, and we're here. Hopefully we should be able to answer your questions. So how do these mental health issues then go on to affect a child's later outcomes?
Okay, so if you think about it, the later outcome, what do you want from your child? You want your child to achieve, you want your child to develop, to function, to be able to become competent, confident adults that is holding down jobs, holding down a family, allowing themselves to move through the society without being swallowed up by the society, a child that is resilient. I forgot to say that the word called resilience is formed as earlier on within the first 2 years of life of your child, what we call the rupture and repair. You know, when you are interacting with your child, sometimes you're cold or something happens, you leave your child and go away, and then you come back, and then you come back again with a big smile to start interacting with this baby and say, oh, mommy's here back, how are you? And then, so the child has learned that something has gone wrong, but then mommy's come back and he's fixed it. So that's wiring in the brain. But if you're interacting with your child and you're doing something and something happens, you pick your phone, and from there you don't come back again, and then you just carry on with something else. And then there's another thing I will talk about that is so key. Please, shouting is not the best for your child. Your baby, especially your baby. Do you know that your baby does not just hear noise, they see noise. They see it as a ripple.
Wow.
Okay, it's like a ripple in the brain. You know that the way if you drop up like a pebble into water and it ripples, that's the way the baby will see it. So it's so key that, you know, all this screaming and shouting and yelling is toned down because you have a baby. But what do we do? And what is that? Hey, you're happy, you scream. You're sad, you scream. You're tired, you scream. You're everything. It's not about screaming. That interaction with your baby, that rupture and repair is so key. If you're interacting with your child, you're laughing with your child, and your child looks away, that's okay. Don't follow them. Okay, because when the baby looks away, some of us will run there and say, oh, are you running away from me? What did I do to you? No, they need to look away because the brain wants to record what it's gained, you know. It wants to wire. And after a while, you see this baby come back. And when they want to look away, some will turn their eyes away, some will yawn, some will start hiccuping, some will start blinking. And with that, it's trying to tell you, I know my brain is hard enough now and I need to chill. We let them go, and then we come back again. So within that, the resilience for your child is built around the interaction of things will go wrong, things will get better, things will go. And when they get older and they now begin to interact with people and move around, things will go. And then they get it. And it continues as they relate with people and things, they fall out with their friends, it gets fixed, they become best friends again. So these are the way resilience is built. And as they get older, so when things are not getting on well, what do? We look for, okay, how do we find what's happening? So we look for an assessment. Sometimes you could assess things at home.
You've actually moved on to the final question there, so that's good. So the final question that I was going to ask our expert today is, what do parents do? What can parents do once they notice the signs? If the issues have gone to a stage that they're actually not able to deal with, what can they do?
What I say is seek help. Okay, seek help. There is this belief that, oh, if you seek help, people will believe that this child will seek help, first of all, from within you. If you've got a husband that's living with you and you've got children, come together. Don't pull apart. Come together and begin to get to where your child is. Get to the point of beginning to interact with your child. As a teenager, I would say to you, more love, more patience, more love.
Yes. Now, patience is something, oh my God. Patience is so important. Sometimes, you know, we expect children to learn things the first time they're taught. But as adults, we don't grasp things that way. You tell the child something, you're trying to take them through a training. Training takes time. But then we're not patient to let them go from stage 1 to stage 2. As soon as they make mistakes, we are shouting, we are screaming, we are punishing them. And then, you know, it's the message they get is it's wrong to make mistakes, it's wrong to keep trying. Until they don't want to try, until it takes a longer time for them to learn the lesson. So let's be patient, parents. training a child is a process, and children learn at different rates. So let's not see what others are doing and say, oh, this person's child, he's doing this already and you're not doing it. It doesn't matter. Let's focus on our children, and let's be patient and ask God for grace and wisdom, because even for parents here who've got more than one child, it's not the same. Each child, I've got 3 girls, they have different personalities. They're all very different. So we can't expect to use the same, there's no one size fit all method, and let's pray as Christians for grace, for God to help us, be patient and take each child step by step to where we really want them to be.
One of the questions you asked me is what will happen if this is not dealt with. Your child will not be able to achieve their potential. It's just as simple as that. If your child is struggling with depression, is struggling with anxiety, is struggling with is self-harming, and is struggling to make friends, is struggling, this child will go to school and is battling with so much. If you think about, if you want to learn, you need to calm down. You need to concentrate. There's issue with concentration when the mental health is not functioning well. There is issue with even social interaction. There's a lot of outbursts. So they make friends and lose their friends because they're becoming very erratic. So the other thing, what I was saying is, one thing is, be very patient with your teenager. And one key thing I would say to us, teenagers sometimes they are wired to annoy adults. And if you are not careful, you will just be concentrating on that annoyance. You will not be able to look at the other things. Teenagers are known to not care about the way their rooms look. Okay, if you're somebody that it winds up, you will go into their room. The only thing I'm just talking, some of the experiences I've had, what you're looking at is that room. You've not looked at anything else, and you scream and you scream and you tell them that they live like junkies. You call them names. It's not getting it. They don't get it. Okay, you can get them. Okay, come on. Let's get this room sorted. The next thing they might say to you, Mommy, I'll do it. Leave it for now and I'll do it. And you come back and then you can now say, okay, right, teenagers like reward. And the reward they like is the here and now reward. It's not reward of 10 years down the line. Okay, what happens when you're 25? No. Okay, get your room done and you're going to get this. If you don't get your room done, okay, so you're asking Mommy for how much money because you want to go out with your friends? Well, when your room is done, we can do that. So the shouting is out of the way. We have a balance. We use other method. And then when we get to our child and we want to interact with our child, we forget about that. The way that room is, you can have a meaningful interaction with your child. And then at the end of the day, that other issue will be done. There is help out there. So what do parents do? Assessment. You assess where your child is. You seek help. Okay, you provide the love, the warmth, and you cut off a lot of the entanglements that is holding you from concentrating in your home. And then you concentrate in your home. There is still time. I said earlier on, the brain of a teenager is rewired again completely. Some of them is rewiring up to 25. Some emerge at the 25. Some people think it's when they are 19, they don't know. Some people are still wiring at 21, some are wiring at 22. You will know when they are done because they will now come back and say, now, Mommy, I know what you've been telling me about. And
it's so important. I think it's so vital because within our community or even in society, we realize that there is a breakdown in relationship between parents and teenagers. And I think, the issue of teenage brain rewiring is what we as parents don't understand, and that is why we've got experts. And I encourage parents to educate yourself. If your child's going through the teenage phase and you see some strange behaviors or some strange ways of doing things, they may be strange to you, but it's all to do with that brain rewiring. Please speak to someone that you think knows more about it. Go on the internet, read about the changes teenagers go through to help you be able to manage them better. Because at the end of the day, as you said, it's about managing these the right way so that we get the outcome that we want out of our children.
Celebrate their strength.
Yes.
Okay. Celebrate their achievement. what we call positive reinforcement. You can never overdo it with your child from the time you give birth to this child and the child is growing up. If you leave a child and the only time you speak to this child is when they've done something wrong, it will be wired in their brain. Okay, so a child is playing nicely with the bricks and it's just not giving you any problem, and it's just playing nicely and making all these, pretend food and come and say, "Mommy, I've just made tea." So talk to this child when they are doing it. Some of us, when they are quietly playing, we don't talk to them because they've left us alone. But then we talk when they do something wrong. You say, "Stop it! What are you doing?" So that for them to get attention, they have to do something wrong.
That is
okay.
it.
So they will do something wrong, they get your attention. They'll do more things wrong, they get you. But then if your child is playing nicely and you go to this child and say, "Mommy is so proud of you for playing nicely. Give me a high five. You're a good boy. Or you're a good child." That wires. The child knows that, yes, playing nicely is good. Not causing problems is good. Because they don't, at that early stage, I'm talking about children in their first few years of life all the way to, but if the only thing we wire is when they do something wrong, then that's wired. I keep talking about the wiring of the brain, because any part of the brain that is not used will be pruned off. That's the way the brain wires for children. So the part that is, if love is wired, love stays. If you keep reinforcing love, that particular connection of love stays. But then if anger and rage is wired, the child will grow up very angry, erratic.
And they start to respond that
way. They'll start
well.
responding that way. I mean, I say to myself sometimes, I wish I know what I know now when I had my first child. Oh, honestly, I would have done things so differently. But I know there is still time,
Yes.
There is still time to do things differently.
Yes.
There are times when you might have to withdraw your child from a particular situation to be able to get them back together and you launch them back into that situation. These children are not us. They are themselves.
They are individuals.
Okay. They are individuals, and they have to form their own character. They have to live in this world, and they have to survive and achieve. So the other help you can seek is, there are what we call the self-help guides. Okay, even for adults, if somebody is struggling with anxiety, there are some self-help guide that will help you. Some reading exercises. Okay, like in the UK, there's what we call the IAP service. Okay, they give you all the self. They are all online.
Online, okay.
Yeah, they're all online. Some people do what we call mindfulness. It kind of a relaxed and then begin to focus on the positive. The people just do it for just few minutes, and you just focusing on it, and just think about that part of your body that makes you think about something that's happened that's good, and then from there begin now. Okay, think about your environment. Look at the environment where you're in. What do you think needs to change? What do you think can be put in place to make this happy? Okay, in your mind, put it in place. Put a flower here. And then all that is going on in your mind, and at the end, it sounds a bit weird, but it makes people feel happier. There are some breathing, and then there is the breathing exercise that is helpful, and then there is if you are in the UK, I don't know anywhere you are in the country, there are some services available that will help your children. It's important to enter in very early so that it doesn't get too bad, because there's a place where you get too bad, then you will now seek psychiatric help. At some stage, the child might not just need some psychological support from home, from psychologists, some counseling support. But then at the intensity of when there is a big mental health problem, the child will need some psychiatric help. Some will need some medication, and we just pray it doesn't get to that point.
So basically what we're doing here is early intervention strategy, so things don't get to the point where we actually need to seek that help, external source of help. Thanks to Ngumga Fonkoyo Shadrach, thank you so much for your comment. It's just gone up my screen now. Let's see if I can bring it down to read it. She says, good point, one size don't always fit all. Every child is different and unique in their own ways. Comparing them with other children, absolutely, I do agree with you, can affect their self-esteem. Thank you to all those who have shared the video. We believe that parents here have been, one or two parents have been touched by what we've just said here. If you have any questions, while we are kind of getting ready to round up to leave you to Sunday. We don't want to eat up a lot of your time. Please type in your questions and we will endeavor to answer them. Parenting is a journey. It's not perfect. So please, when we get things wrong as parents, don't punish yourself. Forgive yourself. Learn from others about what works. So, I mean, there is, as I say, there's no one size, there's no formula, but there are strategies that we can use, you know, in our parenting. So please learn to forgive yourself, learn to give yourself a second chance, just as we also give our children second, third, fourth, fifth, sixth, seventh, eighth chances. It is a journey until they turn 18, go to university. It doesn't end. So I've really enjoyed this discussion today. I believe that we're going to have a few more like this around issues of parenting, because for me, parenting is something I love to learn about. I think there is no one that knows it all. We learn from each other. We learn from the experts. We learn from everything that's out there to kind of give us the information that we do not have and that we need to make us better and more effective in our parenting. So, Annalie, do you want to give last few words to our viewers today before we actually say goodbye?
Okay, what I would say is you don't need to be a perfect parent. What is needed is a good enough parent. It's called good enough parenting, not perfect parenting. So just aim for the best for your child and be the best for your child. Look at things that are distracting you and they're necessary. You've got these children for just the 18 years of life. A lot of them will be out of the home. They will just be coming back now to say, oh, hello, mommy, hello, daddy. And they're out in that first 18 years. Please concentrate. There are a lot of pressures out there. Your child is going through a lot of pressure. Some are being bullied on the internet. Open your eyes. Okay? And the other thing is, please, I will beg parents, be careful the way you talk about your child to other parents. Because other parents might go and talk about your child to their own children, and their children can go and talk to your child about what you said about them. You have thrown that child away. Okay? Whether your child is not behaving well, if you need to discuss it, look for who. There is somebody that God will put in your life that will need to might pray with you and advise you, but not every time, oh, this child is done another one. This child, does that child do any positive thing? Just carry that one for once and just pray, and it will be okay. It's not too late. I always say to myself, it's never late. It's never late. And we will get it right at the end.
Sure. So 3 things we'll leave with you today. Be present for your child. Talk to your child. Love your child. And you said the last one just that I wanted to round up. Pray that God will help you, give you the wisdom to raise your child effectively. And pray, never stop praying for your child. Okay, have a wonderful Sunday and God bless you.